Suspension definition. Suspension, what is suspension? So this is mainly a long questions of 20 marks in which they ask about the suspension. So this is the whole long questions, we will just review it. So suspension, first we will define it. So what is the definition of suspension, like the definition? Okay, so liquid dosage form of medicament in which the finally divided solid particle ranging from zero point 0.5 to 5 micron. This is the range of particle size. The particle size should be from 0.5 to 5 micron. Liquid dosage form in which the medicinal agents, there should be a medicinal agent, that is the ectopharmaceutical, that is the API. We have the API, ectopharmaceutical ingredient. So basically the medicament or the medicinal agent is basically the API. So liquid dosage form of medicament in which the finally divided solid particle ranging from 0.5 to 5 micron are suspended or dispersed. It may be suspended like it would be suspended like this, and it may be dispersed or dispersed. Okay, dispersed is like if we have this for example thing, and this is dispersed. Okay, in a liquid or semi-solid. So we have two options. One is a liquid, we have a liquid medium, or semi-solid. So this is called suspension. Liquid dosage form of medicament in which the finally divided solid particle ranging from 0.5 to 5 micron are suspended or dispersed in a liquid or semi-solid is called suspension. Why suspension as a dosage form? What are the importance? So before we go to this question, that what are the importance of the suspension, we should look at the components, the composition of a pharmaceutical suspension. So we have the components as the API, active pharmaceutical ingredient, we call it active drug substance, and then we have the wetting agents. The wetting agents are added to disperse solids in the continuous liquid forms. Okay, and then we have flocculating agents. The flocculating agents are added to flock the drug particles. To flock the drug particles, we will study the flock. Okay, so then third is, this is the first, we have the wetting agents, then we have the flocculating agents, then we have the thickeners. Thickeners are viscosity agents or the density modifiers, or we also call it suspending agents. So they are added to increase what? To increase the viscosity of suspension. Buffer, pH and adjusting agents. The fourth one is the buffer. Buffers is the pH adjusting agents. What are their functions? So they are added to stabilize the suspension to desired pH range. We know buffers. Now the buffer's functions is to if weak acid or we have weak acid and strong base, and strong acid and weak base, its composition. So if acids or base is added to buffer, it tends to maintain its pH, okay, in a range, okay, in a optimum range. So basically this is the function of buffer, so we add buffers. Okay, power function, the function is to add the desired pH range. So the fifth one that we add, this is the, what are we studying? We are studying the components of the pharmaceutical suspension. This is important, we are studying the pharmaceutical suspension, okay, not the simple suspension. So the osmotic agents, are added to adjust osmotic pressure. From the name it indicates that it will adjust the osmotic pressure comparable to biological fluids. Then we have the colorants. The colorants and the flavorants and the sweeteners are basically added to impart the desired color, taste, and impart the desired color and taste, to impart the desired color and taste to suspension and improve elegance. Okay, this is the sixth one. So we have the sixth number is colorants. The seventh is preservatives. So preservatives are added to prevent microbial growth. And the eighth number is external liquid vehicle. So they are added to construct structure of the final suspension. So what we studied up to now, we studied the suspension main definition, that the liquid dosage form of medicament in which the finally divided solid particle ranging from 0.5 to 5 micron are suspended or dispersed in the liquid or semi-solid is called suspension. Why suspension as a dosage form? We will study it, but before we studied the composition, what are the components of a suspension? First, we have the API, that is the active drug in substance, that is from the name indicates that it's pharmaceutical. So pharmaceutical is API is important. Okay, and so then we have the wetting agents. Wetting agents purpose is to add to disperse the solids, and for the dispersion purposes basically we add the wetting agents in continuous liquid dosage form. And for flocculating agents we add the thickeners, then we add the peppers, and then we add the osmotic agents, also the colorants, flavorants, preservatives, and sterner. Now why suspension? Why suspension? So we use suspension. Advantages of the suspensions. The advantages of suspensions are easily preparable, that it can be easily prepared. Okay, so it is one advantage. The very first advantage is the easily preparable, and the second is the chemically more stable than the solution. The third is the ideal for patient who cannot swallow tablet or capsules. We call it tablets. Tablet mostly marketed as dry powders, and these are all its simple its some advantages, that easily preparable, chemically more stable than solution, ideal for patient who cannot swallow tablet or capsule, and mostly marketed as a drug. Dry powders and materials sensitive to moisture and water. Poor soluble drugs are formulated in suspension form. Better and unpleasant taste can be so the better taste can be any taste which is unpleasant can be minimized in suspension dosage form. Provide a stable form. So it provides a stable form for ophthalmic or ophthalmic eye, and the dermatological, that is skin preparation and mucous membrane, easily absorbed as compared to other forms. So these are its advantages that why we use. So don't confuse advantages and qualities. So the next is what are the qualities of a good suspension. So qualities of good suspensions are settling of the dispersed particle should be minimum. So the settling should be minimum. The should not settle down quickly. Okay, the particles, they are talking about the API or the particles we dissolve in it. Okay, so they are not completely dissolved, they are basically dispersed or suspended. So settling of the dispersed particle should be minimum, should not settle down quickly, redispersed immediately on shaking. This is the very good quality. And the particle should not form cake on settling, easily pourable, should be chemically stable, should be palatable. Suspension for external use should be free from gritty particles, and dispersion of the particle must be uniform, should be chemically and physically stable, should have resistance to microbial growth, should be thixotropic. What is thixotropic? So become viscous on standing and thin readily on shearing, means shaking. Okay, then palatable, taste, odor, and color. Particle size should be such that optimum viability is achieved. Suspension intended for injections must have particle size that can easily pass through syringe or needle, and ophthalmic suspension must have particle size less than 10 micrometers. So this is important, that the ophthalmic suspension must have less than 10 micrometers. Okay, then we have the suspension types. What are the types of suspension? So we have the flocculated suspension. We have the flocculated and deflocculated. So what is flocculated suspension? Individual particles are in contact with each other to form a loose aggregate and create a network-like structure, as shown in this pencil diagram. They form a flock. So the rate of sedimentation is high, but due to the loose packed particles, they can redisperse easily. So the particle of the particles of the flocculated suspension become stick with the wall of the bottle, which can be improved by adding protective colloids. The next is the deflocculating suspension. So the deflocculating suspensions are individual particles are settling, so rate of the sedimentation is low, which prevents the entrapping of the liquid medium, which makes it difficult to de-disperse by agitation. This phenomena is also called cracking or clang or caking formation, as shown in this diagram, cake form. So the random motion of particles is in a fluid, a liquid, or gas resulting from their collision with the fast moving atoms or molecules in the gas or liquid is called Brownian motion. This is the extra information. So this transport phenomena is normal and Brownian. Robert Brown mainly discovered this. So this is mainly the suspension part 1, and then we have the another, like what is the difference between the flocculated and deflocculated. So we have to write all these points from this. The particle exists in suspension as separate entities, and so this is mainly for just reading for the paper point of view. If the difference comes, so we should write here it. Okay, this is mainly the difference. Then we will write about the preparation of the suspension, that how suspension can be prepared. So we have two methods, one is on small scale, another is on large scale. So this first we will discuss the suspension small scale. This is important. Small scale is preparation and large is production. So large scale production, this is important. Okay, so we have this, that what on small scale motion and motor and vessels are used. Okay, and steps include this. Add steps. The drug is saturated in a motor with the help of the vessels to find the particles. The suspending agent is added with the small amount of water to form a mucilage. Then the mucilage and powder is ligated to form a paste. Then the sufficient amount of vehicle to form, and these are the steps that flavor added, then all the mix, and then transparent. This is the steps. Okay, then we have the preparation of the suspending or large scale production. So suspension are prepared in large mixing tanks. We use tanks with the variable speed steering devices. These are what are they? They are propeller, turbine, impeller, etc. After mixing, then pass through the homogenizer or collider melts, then the mechanical. These are all. Then we have the mechanism of homogenizer that pass through a narrow orifice. These are all the mechanism. So this is all about suspension. Thank you so much.